How do doctors use differential diagnosis for CFS? Imagine trying to find out what's making someone feel extremely tired and unwell. Doctors do this through a process called differential diagnosis. When it comes to chronic fatigue syndrome, also known as myalgic encephalomyelitis, this process is especially important because there is no single test that can confirm it. Instead, doctors carefully look at all possible causes of the symptoms and rule out other conditions that might look similar. The first step is to confirm that the patient has severe, ongoing fatigue that lasts at least 6 months. This fatigue must be so intense that it stops them from doing normal activities and does not get better with rest. A key feature of chronic fatigue syndrome is post-exertional malaise, which means that even mild physical or mental activity can make symptoms worse for more than 24 hours. Doctors also check for other common symptoms like unrefreshing sleep, problems with memory or concentration, and dizziness when standing up. These symptoms need to be persistent and significantly interfere with daily life. Next, doctors look for other health issues that could cause similar symptoms. They perform a detailed medical history and physical exam. They ask about when symptoms started, how long they have lasted, and how severe they are. They also order blood tests, imaging, or other studies to rule out conditions like sleep disorders such as sleep apnea or restless legs syndrome, hormonal problems like hypothyroidism or diabetes, blood conditions like anemia, mental health issues such as depression or anxiety, autoimmune diseases like lupus or rheumatoid arthritis, infections, or even cancer. Since chronic fatigue syndrome is a complex condition affecting multiple systems, doctors pay close attention to specific features like post-exertional malaise and cognitive problems. These are not typical in many other illnesses. The National Academy of Medicine recommends using these key symptoms to help distinguish CFS from other causes of fatigue. Sometimes, doctors also check for overlapping conditions like fibromyalgia or irritable bowel syndrome, which often occur together with CFS. By carefully analyzing all these factors, the doctor can decide whether the symptoms are best explained by CFS or if another condition is responsible. This thorough process helps ensure the diagnosis is accurate. It also guides appropriate treatment and prevents misdiagnosis. Remember, because each person's experience with fatigue can be different, it's important to work closely with a healthcare professional who can tailor the evaluation to individual needs. Always seek personalized medical advice if you are experiencing persistent fatigue or related symptoms.